Hey, Dr. Terri DeNeui here, nurse practitioner, and I'm going to talk today about melatonin and melatonin's role in the immune system. Now, first of all, I just want to put out there that if you do not have a patient-provider relationship with me, please don't take this as medical advice. I am creating these videos for informational purposes. I've been teaching about melatonin and its immune-enhancing properties for a long time now, but I wanted to share how it can directly help us with viral disease and progression from a viral pneumonia to what's called adult respiratory distress syndrome, and how melatonin can play a role in slowing down or even stopping. Some studies have suggested that progression. So first and foremost, I just want to dispel some myths about melatonin. Melatonin is not a sleep aid. Melatonin is an amazing molecule that's secreted during sleep. For most of us, if we have complete darkness, it's stimulated when it gets dark. It is released when it gets dark to tell our brain, okay, it's time to go to sleep and rest and recover. But a lot of people think taking melatonin is like a sleeping pill, and it's not. It's not a sleeping pill. It's not a sleep aid. Many people take some melatonin during the day when they're melatonin deficient, which is a recommendation when we're ill. I'll talk about that in a minute. But just understand, if there is a lot of light around you when you're asleep at night, you're not getting good melatonin production. Children who fall asleep in front of TVs or screens, even though children have very high levels of melatonin production up until about the age 10 or 12, if they're exposed to a lot of light during the sleep times, then their melatonin production will decrease. Night shift workers, people that are constantly stimulated with light, and not necessarily just light from the sky or the sun, but light from TV screens and computer screens. So the first advice I would tell you if you want really good melatonin production yourself is to have a completely dark room. Don't have TV screens or phone screens or anything like that on at night. But melatonin is a powerful immune enhancing molecule. And the reason this is important to understand is there are many studies that show low melatonin levels to be directly correlated with cancers, heart disease, and many diseases of inflammation. And this is the key thing to understand, because the part of this whole COVID-19 that progresses to what we call adult respiratory distress syndrome has to do with something called the NLRP3 inflammasome. So that is NLRP3, big fancy word called inflammasome. And this is what directly causes the progression of a respiratory distress, full pneumonia, full-blown respiratory distress. And what we see in studies is melatonin actually can halt the production of this inflammasome. So it's a really important supplement to take anytime you're sick. But the other thing that we have found is melatonin and vitamin C, remember the other videos on vitamin C, work together. They work synergistically to block this inflammasome production. So if you remember, that should be a T. If you remember that when we talked about vitamin C in the other videos, we talked about how vitamin C increases T lymphocyte production and natural killer T cells, among other things, but it also plays a direct role in stopping the cleaving of this virus replicating in the lungs. So it's powerful, and these two are powerful together. So one of the explanations of why our children not get, what superpower do children have, if you will, that are keeping them from getting so ill with this particular COVID-19 sickness from the coronavirus. And one theory is because children have about 10 times the melatonin production as adults if it's dark, obviously. But even when, kids sleep with the bathroom light on, that's fine. But what you really want for everyone is complete darkness as much as possible. The other thing that children have that adults don't have is an active thymus gland, and thymosin alpha-1 is a peptide that enhances immunity, and it protects babies and infants and children from, it boosts their immune system and T lymphocytes as well. So melatonin for adults, what I recommend to my patients and what I take when I'm not sick is anywhere from 3 to 5 to 10 milligrams at night. When people travel, there's a physician that I work with that travels overseas to speak quite often, and when he comes back into our time zone, he takes up to 100 milligrams of melatonin just to reset his internal clock. Night shift workers should be probably taking 10, 20, 30 milligrams of melatonin right before they go to sleep, just to kind of help their bodies recharge and recover and help their immune system and their inflammation. And then there are some resources that say during times of illness, especially if you get particularly sick with COVID-19 from coronavirus, that up to 50 milligrams a day of melatonin has shown to be beneficial. And some resources recommend you split that dose and take 60% of that at night and 40% of that during the day. So for instance, if you were going to take 30 milligrams, you could take 20 at night and 10 in the day, or 5 during the day and 25 at night. Just kind of split it up so your body has that immune fighting molecule all throughout the day. So hopefully this helps you understand a little bit about melatonin. There's so much more to talk about with melatonin, but just understand that it is an incredible immune enhancing and inflammation reducing molecule that we do need extra as we age.